Hi everyone. We'll just give folks 1 minute to join, but thank you for joining us today for our sort of third deep dive webinar. And stay tuned to getting started in a second. Okay, so we see the numbers of attendees going up. That's great. I'm Beth Kenefick. I am here to kick off our Save Our SNAP 201 HR1 program changes in Illinois webinar. It's February 10th, 2026, and we're here on behalf of the Illinois Commission to End Hunger. I'm with the Greater Chicago Food Depository. I'm joined by my colleague Nolan Downey, as well as Melissa Kundari with the Illinois Department of Human Services. And we're all here on behalf of the Commission to talk to you about the SNAP changes. Just as a reminder, the Illinois Commission to End Hunger is a public-private partnership composed of stakeholders from across the state. There's information that we can put in the chat, but this is a commission that we've been together for many years trying to end hunger in Illinois, and we know that these SNAP changes are an important reason to be gathering again. So just some welcome and housekeeping. You'll see the agenda looks pretty similar to the past agendas. We will go through some items we've talked about before, as well as include some new information. But we'll start with some important updates. We will go a little bit more into the immigrant changes that we haven't done so yet on previous webinars. Go back through the SNAP work requirements, particularly reviewing some of the exemptions, and then trying to share some scenarios around reporting obligations. And then, like always, we'll end with some opportunities to take action, some resources, and Q&A. Just like in the past, just remember that this information is accurate as of today. Things are continuing to change. And if you have questions that you want answered, please put them in the Q&A box. We will either address them as we go on or at the end of the webinar live. Just to ground us in sort of what happened and how we got here, HR1, the One Big Beautiful Bill Act that was passed July 4th, 2025, made incredible changes to the SNAP program, which impact all 1.9 million residents. But we're really focusing on the changes that are on the left side, the increase to the state cost requirement, vastly expanding the failed work requirements, and then barring SNAP benefits for many legally present immigrants. And I encourage you to watch the 101 where we go into a little bit more about all of these changes and explain sort of what they are, what they're doing. But today we're really going to focus in on some of the technical things. So first, just some important updates on the non-citizen eligibility changes. Nolan will go into this next, but just saying it will begin soon. And then on the work requirements, a policy manual release was put out by the Illinois Department of Human Services. We're very excited about this. It updates a policy memo that was shared in October of last year and really tries to clarify and simplify a lot of the changes around the SNAP work rules and really shares a lot of the information that we're presenting to you today. So we encourage folks that have looked at those before and are interested to look at that. And then as always, you can visit the SNAP Federal Impact Center for more updated information. All links that we can put in the chat as we move forward. And with that, I will pass it to Nolan to start talking about the restricted immigrant eligibility.
Yeah, thanks, Beth. Hi, everyone. Nolan Downey, Senior Director of Policy at the Food Depository. And just want to take a minute to again acknowledge we've got almost 200,000 people on the, or 200 people, 200,000 would be amazing, 200 people on the line here. But that 200 is a very significant number. And just want to thank everybody for walking on the journey with us over the course of this webinar series. We did an overview of the changes. We covered details around exemptions, which remain important, and that we'll double click on a couple big points around exemptions today. We shared what we know about compliance. How is it that people can meet the work requirements? And today we'll again address some of the frequently asked questions that we've been getting in that bucket. But as Beth mentioned, one thing that we haven't spent a ton of time on is the changes to immigrant eligibility and some other special considerations with this population. So wanted to spend a little bit of time talking about it today. Despite the SNAP program being available to certain lawfully present humanitarian immigrants for decades, after H.R. 1, immigrant eligibility for SNAP is going to be limited to LPRs, lawful permanent residents, that's your green card holders, Cuban Haitian entrants, and COFA migrants. That's Compact of Free Association. It's like some islands in the Pacific, Micronesia, Palau, the Marshall Islands. And that is it. It's just those three statuses in addition to U.S. citizens. And just to make clear some of the statuses that get left behind, that's many humanitarian statuses. So it's your refugees, asylees, T visa holders, victims of trafficking, parolees, victims of direct domestic violence, all lose eligibility. So the department estimates that as many as 16,000 people in the state could be impacted by these restrictions. But as Beth sort of noted, one critical detail is missing here, which is exactly when this is supposed to happen. I did just want to note that we don't know for sure, but I wanted to share a little bit of what we do know. So if we go to the next slide, these restrictions are not currently in effect. People who are in these statuses who are no longer eligible, like asylees, refugees, they could apply for SNAP today and be approved. So these restrictions are not yet effective. People who are in active SNAP households could also do their redeterminations today, and those would be approved. The exact date for the beginning of the restrictions is not clear, and it has been the subject of some litigation, which always makes things a little bit more murky. If you've been following the Food Depository's content closely since the bill passed, at one point we thought the start date for this was going to be December 1st. That got disrupted by the lawsuit. Then as USDA put out some revised guidance, there was a sense that maybe April 1st was going to be the start of these. And I believe we even said that on the last webinar. That still may end up being the start date, but do want to be clear that right now we don't know for sure. Here's a couple of things we do know, though. These restrictions are going to affect both adults and children. So sometimes you see that the children are exempt from certain restrictions. This one also applies to children. So if they're not in one of those statuses, U.S. citizen, lawful permanent resident, Cuban Haitian entrant, or COFA migrant, the children in the household will also lose eligibility. We also know that this is going to be happening for people at their redetermination. So people are not going to lose eligibility all at once. Instead, they will roll off the program when they go to do their next redetermination. So for example, if an asylee applies today and they're otherwise eligible, they would be on the program through their 6-month redetermination period if they were otherwise eligible that entire time. And even if those restrictions start in the meantime. So again, there was a point where we were worried that once these restrictions went into effect, everybody would lose eligibility all at the same time. That's not going to happen. People are going to be rolling off the program at their next redetermination. So it's going to be kind of dependent on the length of the household certification period, when their redetermination is, that's going to dictate when they're going to feel the impact of these. The other thing I just wanted to uplift is there are a number of these households that are mixed status households, perhaps a refugee parent and U.S. citizen children, for example. Any household members who are in the eligible status can maintain benefits. So those U.S. citizen kids in this example would keep benefits. So again, let's imagine there's a refugee parent and one child, a 2-person household. What would happen is the refugee parent at the time of their redetermination would be removed from the household and benefits would be recalculated for a household of 1. So that household will still maintain a connection to the program, but at a reduced level because it's now a smaller household size. The other thing that I'll just uplift is a very important flag is that some people who are impacted by the eligibility restrictions in HR 1 may still be eligible for some ongoing support at the state level. So folks on the call may be familiar with this, but we already have a state-funded SNAP lookalike program called the VTTC Food Program, the Victims of Trafficking, Torture, and Other Crimes Program. The state law for that program is written in such a way that the department has flexibility to open up the program to some, not all, as currently written, some of the statuses. So T visa holders and asylees with derivative family members, those folks, and again, derivative family members means spouses, children, those folks could be eligible for VTTC food, and that would also happen at their redetermination. So hopefully those are folks that would be seamlessly transitioned from the federal program onto the state program, assuming that there's still funds available for the state program. For people familiar with the program, there have been times over the years where eligibility has had to be capped and other things. But assuming there's funding available, those are some folks who may be eligible for some ongoing support. So we want people to be aware of that. A couple other considerations to uplift. If we go to the next slide, lawful permanent residents, your green card holders, these folks are subject in federal law to a 5-year bar. Again, this applies just to the green card holders who are going to be maintaining eligibility for SNAP. Generally, people with a green card have to wait 5 years to be eligible for federal public benefits. But there are some exceptions to this rule. So here's an instance where children are exempt from the 5-year bar. So if a child gets the green card, they don't have to wait 5 years. They could be eligible for federal public benefits right away. The other important thing here is that there's an exception for people who transition to LPR status. They get their green card after having entered the country as a humanitarian immigrant. So refugees, asylees, folks in those statuses, if they then obtain a green card, they're also not subject to the 5-year bar. So the way that that plays out in practice with a lot of folks who are being impacted by this policy is that many of the folks who are going to be losing eligibility for SNAP, asylees, refugees, these are folks that if they were to obtain their green card in the future, most of them are not going to be subject to the 5-year bar because they're in one of those humanitarian statuses that made them eligible for SNAP in the first place. So we wanted to uplift this. This is out there. But hopefully some of the folks who are going to be losing benefits, if they get back on the path where they're able to get benefits as a green card holder, they would not be impacted by this. So it's a little bit confusing, but that's sort of the application of the 5-year bar. And we can answer any questions about that. Another thing, talk about confusing, is the public charge concept. This is more ground that may be shifting beneath our feet, but it's relevant for this population. And many of you will remember during the first Trump administration in 2019, there was an attempt to really dramatically expand the application of the public charge test. This test is a long-standing part of our immigration law. It's designed to identify people who may depend on the government as their main source of support in the future, but it's also a multi-factor test. It's supposed to look at people's age, their education, work experience, in addition to previous use of public benefits. A couple of things I want to uplift here is that the public charge test does not apply under federal statute to refugees, asylees, survivors of domestic violence, T visa holders. Again, many of the people who are going to be losing eligibility for SNAP, if they were to obtain a green card and apply for SNAP again in the future, they would not be subject to the public charge test at that time that they go to apply for a green card. Because again, the public charge test only applies to people who are trying to obtain their green card or enter the country through one of a number of pathways. I will also say that currently use of SNAP is not considered in the public charge determination. So it looks at the past use of previous public benefits. It might be cash or institutionalization at government expense, sort of like that long-term care on the healthcare side. But SNAP currently is not considered by the public charge test, but I will uplift that in November, the second Trump administration now has put out a notice of proposed rulemaking saying that they intended to overturn a 2022 rule that was put out by the Biden administration. But in doing so, they're not clear about what will replace it. So I did want to uplift that there's still some shifting that's happening here, but the content from that rule strongly suggests that SNAP may be counted in the future. But again, we're hoping that many of the folks who would be eligible for SNAP would be eligible for SNAP because they're in statuses that would not subject them to the public charge test. So we'll continue to
So,
keep people abreast of the situation. Yeah, Beth.
I'm just going to insert myself. There was a question if you could give a 30-second explanation of what public charge is, and then we can drop a couple of links around organizations that know more about it than we do. We're typically not leaders in this space.
For sure. So the public charge test, again, it's a longstanding test in our immigration law that is designed to try to identify people who would be primarily dependent on the government for subsistence and then potentially block their ability to adjust their status or enter the country. Again, it's supposed to be a multi-factor test. So past use of public benefits is just one factor that they look at. They also look at age and other things. But that's the significance of the public charge test, is that if somebody is deemed a public charge, they may not be able to adjust their status or enter the country. But again, I think I want to uplift that this is something that's out there. It's something for people to think about, but people should really look to National Immigrant Law Center, the Protecting Immigrant Families, national and statewide coalition for more information on this. I think the biggest thing with public charge is that it doesn't apply to everybody, and most of the people who would be impacted by the changes in HR 1 are folks that are not subject to the public charge test. And so as a practical matter, we think the impacts for this population should be limited, but just wanted to uplift it because we constantly get questions about public charge, and also note that there are some changes that could be coming down the pike from this federal administration as well that we're monitoring. So happy to continue to answer questions about that in the Q&A, but did want to uplift this for this population because, again, this is something that we know from last go around caused a lot of consternation in community, understandably. So again, want to kind of double click on a couple of things related to exemptions. But before we get to that, recall that with work requirements and SNAP, there are two different sets of work requirements. There are the work provisions and the SNAP work requirement. Only that latter one, the work requirement, was expanded in HR 1. And the biggest change, if we go to the next slide, was who has to meet the work requirement. And the work requirement is that folks have to work or engage in some other type of qualifying work activity for 80 hours a month, or they only get 3 months of SNAP in a 3-year period unless they regain eligibility or become exempt. And so the previous policy of who was subject to this, it was people between 18 and 54, didn't have any kids, didn't struggle with any type of disabilities or physical or mental limitations that impacted their ability to work, and they had to work 80 hours a month, or they only got 3 months of SNAP in that 3-year period. But states with sufficiently high unemployment, like Illinois has had for, roughly 20 years, could waive this policy. And so for much of the last 20 years, we have had a waiver of this requirement and have not had to implement it except for in one county for 2 years in 2018 and 2019. So while this has been a policy in SNAP for some time since welfare reform, the state has not really had to deal with it before. So HR 1 not only removes or really limits states' ability to get those waivers, but it also, again, as everyone knows now, expands who is subject to this work requirement. So in addition to those folks that I just mentioned, we're now bringing in families who have children age 14 and older. We're now bringing in non-disabled adults between 55 and 65. And it also gets rid of previous exemptions from the work requirements for folks like veterans and youth aging out of foster care until they turn 25. And again, critically, also really limits the state's ability to waive these requirements. So that's just, again, ground people in the expansion here. If we go to the next slide, the biggest update that we have for you now on the work requirements front is that they are currently in effect as of February 1st. So February will be that first countable month for people who are not exempt and not meeting their 80 hour of work activity in the month. So we have religiously stressed that many people should be exempt, and there is still time to submit those exemptions, even though we're past February 1st. Months are only counted if people are in a non-exempt status for the entire month. So exemptions submitted before the end of the month, if they're approved, would result in February not being counted as that first strike. So now is still a great time to get exemptions in. Indeed, even beyond February, now is never a bad time to get an exemption in. If you're exempt or you become exempt, always make sure that the department has that information as soon as possible so that folks can either get reconnected to the program if they lose, or they can stop from using up any of those countable months unnecessarily. But did want to be clear, work requirements are in effect, but you can still and should still submit your exemptions if one of the exemptions applies to you. And if we go to the next slide, this here is again the full list of exemptions. We went through each of them in some detail during our second webinar. We're happy to answer any questions about these during the Q&A if there are still some lingering follow-ups. But there are a number of exemptions and people should continue to get those in. One of the questions that we get, if we go to the next slide, is, what if my exemption status changes mid-certification period? We talked about this a little bit in a previous webinar, but we wanted to just uplift it again. There's a lot of text here to make a point that's pretty simple. If somebody is exempt and they lose their exemption status during their certification period, maybe their circumstances change. Maybe someone was, for instance, in a substance abuse treatment, but it finishes, or maybe somebody had a temporary physical or mental limitation that resolves at some point during the certification period. A change in exemption status is not a reportable change. So people don't have to report that. On the flip side, if somebody is not exempt, and they become exempt at some point during the certification period, they don't have to report it, but they absolutely should, because that could keep them from counting months unnecessarily. So again, I think it's a little bit counterintuitive, but if somebody's in an exemption status and they become non-exempt, that's not a reportable change, and that exemption status will be in effect until the redetermination. So that's a critical point. It'll become relevant again later as we walk through some examples of how this plays out. If we go to the next slide, I also wanted to spend some time going over some of the exemptions that we've been getting a lot of questions about. So there are three that I'm going to talk about here that are especially relevant because these are places where somebody who falls into these categories may have to take action. They may have to actually do something to get plugged into these exemptions. Recall that there are some exemptions that IDHS can do automatically. And it's relevant for this one because if somebody is already on disability benefits like SSI, they get plugged into an exemption status automatically. They don't have to do anything. But if someone is struggling with a physical or mental limitation that impacts their ability to work, but they don't receive disability benefits or anything like that, they can still be exempt, but they need to tell the department about the circumstances that are limiting their ability to work. That can be a number of things. Again, really any type of physical or mental limitation that is impacting somebody's ability to work that 80-hour a month requirement. Make sure that the department is aware of that. This one also specifically considers things like if someone is experiencing homelessness or if somebody is the victim of domestic violence and those circumstances are impacting their ability to work. You might not see those two things show up on a list of exemptions, but they fit within this one. So people should ensure that IDHS is aware of those circumstances as well. If someone is experiencing homelessness or if someone is struggling dealing with domestic violence, those are also things that could be considered as a part of this exemption. If we go to the next one, it's the same thing with caretaking, where there are many people in our lives who have caretaking responsibilities, maybe for children, older adults, disabled adults. But if that person is not in your SNAP household, IDHS wouldn't necessarily know that you have caretaking responsibility for someone outside of your SNAP household unless you tell them. So if you're caring for someone that's not a part of your SNAP household unit, particularly if it's a child under age 6, or if it's an adult that needs care, please just make sure that you tell the department about that, because that could give rise to an exemption. And then the last one I'm going to touch on again is the exemption that's based on earnings, because this one is a little confusing. It'll become relevant as we walk through some scenarios on this. Recall that there is an exemption for people who are working and earning the equivalent of 30 hours of the federal minimum wage. And this can be for people who are employed or self-employed. What matters here is not the hours worked, but the amount of earnings. So for example, a SNAP participant could work, just about 13 hours a week at the current minimum wage in the city of Chicago, which is $16.60, to earn the equivalent of 30 hours of the federal minimum wage, which is only $7.25. So this is one of the advantages of having a higher minimum wage in the city and in the state, that people can become exempt based on their earnings before they actually get to 80 hours. So what you functionally do is you turn an 80-hour requirement into something closer to like a 57-hour requirement in the city of Chicago, slightly more in other parts of the state. But that's critical because it's coded in the system as an exemption. And we'll talk again about some of the relevance of that. But this one has to do with people's earnings. And there are a lot of people that fall into this category. Well, they'll be exempt in the system for this reason, even if they're not getting all the way to 80 hours in a month. If we go to the next slide, this is just a reminder of some of the ways that people can submit their exemption requests. They could call the hotline. They could go to an FCRC to discuss their circumstances. They could also mail in the Form 2341 that we've circulated a few times. They could also upload the form to Manage My Case. They could go through the Manage My Work requirement button on Manage My Case. There are a number of ways that people could submit their exemption requests. And again, now is still a great time to do that. The next thing is, one question that we get all the time is, once I submit an exemption request, what happens? Some of that could depend on how you submit it, but we have a little bit more clarity now because of the issuance of the policy manual that I wanted to walk through with folks. So if an exemption is approved, people will not get a special notice indicating that their exemption request has been approved. But there are a couple things that we may be able to look at that would give us an indication. And then, of course, when in doubt, people can always call the department to verify, hey, am I in an exempt status? I submitted a request. What happened? One hint that people could look at is, for those that have access to Manage My Case, generally, if the Manage My Work requirement button is appearing in Manage My Case, that means that IDHS thinks that there's someone in the household that may be subject to the work requirements. If it's not there, that generally means the opposite. IDHS either thinks that people in the household are not subject to the work requirements or they're exempt. So if you see the button, it's not foolproof. It's not 100%, but that's one indication of a person's status with respect to the work requirement, is that button showing up in Manage My Case. I will also say that people who submit their exemption request using Manage My Case, using that Manage My Work requirement button, they will get a receipt that something was submitted. Now, that receipt will not tell them whether it was approved or denied, but it's something that they'll have that they can go back and say, yes, I have proof that I submitted a request at this time. As we all know, not everyone has access to Manage My Case. It's an excellent tool, but we can't always take that for granted, because there are some folks that do struggle to get on there. But I think this is one thing that we want to say out to the field, where if that button is appearing in places where people think that it should not be appearing, like if someone is clearly exempt, but they're still seeing the button, those are the types of things that we want to be able to uplift to make sure that everything is running as smoothly as possible with the system. But that's just one indication of whether somebody may be subject to the requirement or not, is do they have a button within Manage My Case to go in and manage my work requirement? On the flip side, if an exemption request is not approved, we now have a little bit more clarity on what exactly happens. So if it's not approved, that doesn't mean that it's denied. It means that IDHS feels that they need more information. Perhaps they think their information is questionable or there's contradictory information in the system and they just have a little bit more questions about the person's circumstances. In this case, what they will do is send a verification checklist to the household asking for additional information. And it should have the language on it that you see here in the slide. Just that little sub bullet there. That'll appear on the verification checklist to let people know that this is the reason that they're getting this. If the exemption request was based on a medical exemption, the department may also send this form 2340, which is a form directed at medical or other service providers to verify people's circumstances. So important to recognize that if a verification checklist is received, that generally means that the exemption hasn't been approved yet. And so that clock is still ticking. And so people may need to submit some additional information. If we go to the next slide, I want to review just a couple of things about compliance. Again, we touched on this in our last webinar, but just to remind folks, people can meet the work requirement by engaging in traditional work. That could be paid work. It could be unpaid work. They could participate in a qualifying work program. That could be through SNAP ENT, WIOA, something that the state or another subdivision of the state operates. They could also volunteer, doing self-initiated community service. And that's where we wanted to kind of, again, raise up some things that we've learned since last webinar that are responsive to a lot of the questions that we get around volunteering. So if we go to the next slide, we get questions all the time from organizations that want to know what they can do to help people meet volunteer hours for SNAP. And I should say that we don't recommend people volunteering for 80 hours. It's a lot of uncompensated labor to get, a relatively modest SNAP benefit. But where we often see volunteering coming in is to supplement other activities so that people can get to their full 80 in a month. And so for organizations who have these opportunities available to the community, we highly recommend them putting them on this central platform that the state has created, this Galaxy platform that's run by Serve Illinois. This platform is searchable. It allows people to easily find volunteer opportunities near them. And the site also will track people's hours and generate a report that can be used for their records. Another thing that would be a good practice for organizations who are providing these volunteer opportunities, making sure that people leave that opportunity with some type of very simple document or letter that says their name, the date that they volunteered, the organization that they did it with, how many hours, that is also signed by someone at the organization who's providing the volunteer opportunity. If people have any questions about this, please reach out to us and we can share more instructions about how to get onto this Serve Illinois platform. And we also have a template letter that the Food Depository uses for other organizations to adapt, again, so that people leave with something saying, I was here on this date and I volunteered for this many hours. If we go to the next slide, this is just another reminder that 80 hours a month means 80 hours a month. You sometimes see this expressed as an average of 20 hours weekly, but there is no weekly hours requirement. It's really just about the calendar month. You got to get to 80 hours in the calendar month. On the next slide, for people who fall short of that 80 hours, it's, again, always very important to remember the concept of good cause. Oftentimes, if someone doesn't get to their 80 hours, there's a reason. And that reason, if shared with IDHS, could prevent someone from losing one of their accountable months. So what is good cause? Well, this is, again, one place where the agency has there's a lot of flexibility here because the federal regulations say that good cause could be any situation really beyond the individual's control. And it does call out a few specific things, like somebody gets sick, or, maybe their manager reduces their hours, their car breaks down, or they have to respond to some other type of emergency. Life happens. And so there are infinite circumstances really that could cause a person to miss work, and thus not meet their 80-hour requirement. So, we always want to uplift this again. If folks are sharing with the department that they didn't get to their 80 hours 1 month, that is a reportable change, but it's very important to say why, because then they could have good cause. And just as with exemptions, if we go to the next slide, merely telling the department about those circumstances that gave rise to good cause uh, could be enough. No documentation is going to be required. It's only going to be required if something is questionable. So again, like my car broke down, I got sick, my kid got sick. Caseworkers are generally not going to be asking people to prove it unless they think the information is questionable or there's some other contradictory information that they have. If we go to the next slide, one more thing to layer on here is the reporting. And we wanted to spend a little bit more time on this because this is a lot of the questions that folks have. When do I have to report? What do I have to report? With the department's recent adoption of simplified reporting, even those who are subject to the work requirement now have like some reduced reporting obligations. People should always, again, report if they're exempt, not because they have to under program rules, but because it could keep them from unnecessarily losing any countable months. Under program rules, people always have to report if their income goes above the income limit for the household size. So basically, if your income changes to the point where you're no longer income eligible, that is a reportable change. So always making sure to tell the department that. But generally, and in particular with traditional work, people are now not obligated to report every little change in their circumstance or income. What really matters for purposes of the work requirement is, are you getting to 80 hours or not? So it's sort of a binary. You're either meeting it or you're not meeting it, and reporting only when you shift between those two things. So if you go from meeting it in 1 month, I got to 80 hours, I got to 85 hours, and the next month you get to 75, that is a reportable change. You got to notify the department of that. But again, making sure that you're telling them why that happened. And if there's a good reason for that, then you could have good cause and not lose a countable month. But if there's no good cause, that is something that would result in a strike. I wanted to illustrate this during this webinar with a couple of scenarios. So if people will indulge me, I wanted to walk through a couple different examples that maybe get at some of what people's reporting obligations are going to be now that we're in this work requirement world. And so I want to start with this one where we imagine a person that, may have an exemption. So in this example, SNAP participant A, they apply for SNAP. Maybe this is a person that struggles with severe anxiety that limits their ability to work 80 hours a month. Again, they don't have to be on SSI, they don't have to be receiving treatment necessarily, but if they have this limitation that is impacting their ability to work, they say that to the department doesn't deem it questionable or anything like that, they would be exempt. Now let's imagine a situation where sometime in the reporting period, this person undergoes treatment and some of the anxiety resolves and they're able now to start begin looking for a job. It's impacting their ability to work less. This would not be a change that this person would need to report. Because again, as a reminder, changes in exemption status, that's not a reportable change. So what would happen is at the next redetermination, this person would be rescreened for exemptions, and it's possible that this one may no longer be applicable because they're not dealing with a situation that's limiting their ability to work in the same way. It's also possible that they may have started another job or something like that. I think in those instances, anytime you start a job, IDHS will get a notification of that. But this is one where we use this example just to highlight that this was a person that was exempt, their exemption status changed, but it doesn't need to be revisited until their next redetermination 6 months later. If we go to scenario 2, this is one that kind of overlays with the exemption based on earnings that I was talking about. So I want to kind of spell this out because, again, we think this is a situation that may arise quite frequently. So here, let's imagine a person that's working 60 hours. They're not getting to the full 80, but they're working 60 hours at Chicago's minimum wage, $16.60 before taxes. That comes out to about $996 a month, if my math is correct. And that is greater than 30 hours per week at the federal minimum wage of $7.25. So a little bit of math required here, but there's a threshold over which if you get over the earnings, that's that 935.25 figure. If you get over that for the month, you become exempt based on your earnings. So this person, they're not getting to 80 hours a month, but they're nonetheless exempt because their earnings are sufficiently high to put them over that threshold. Now let's imagine next month this person's manager at their job reduces their hours from 60 to 40. Now, that would move them underneath that threshold. So they would no longer be in an exempt status. But again, this is not a reportable change because they didn't go from complying to not complying. They went from exempt to not exempt. And changes in exemption status are not a reportable change. So even though this person has had their hours reduced, and even though they're no longer over that threshold, it won't be revisited until they go at their next redetermination and they're rescreened to see if there are any other exemptions that may apply. And then if we go to the last scenario here, this is one where now let's imagine a person is working 40 hours a month. So it's a similar deal. 40 hours a month at that higher Chicago minimum wage, $16.60 before taxes. And then let's say to get to their 80 hours, they're volunteering. Maybe they're volunteering 40 hours a month. The reason that they do that is because at 40 hours worth of earnings, they're not getting above that threshold to be exempt. So they need to supplement their activity with something else to get to the full 80. So this is a person that would be complying with the work requirement. They're working 40 hours. Their earnings aren't sufficient to make them exempt, but then they come in with the volunteer hours with another 40 to have a total of 80 for the month. So they would be complying. Now, let's say next month, that person misses a volunteer shift. Maybe they were coming to the food depository and they got sick. That would be an instance where they may have good cause. So if they missed a shift because they were sick, and instead of getting the 40 hours of volunteering, they only had 32 for a total of 72 hours in that month. That would be a reportable change because I went from complying to not complying, but I got to tell the department why that happened. I got sick. I missed a shift. And in that instance, assuming that there's nothing questionable about that situation, that would be an instance where a person would have good cause for not meeting the work requirements, so they would not get a countable month. So just a couple of examples there. You know, we could do a million different examples, but I thought these were some that kind of illustrated the key points. We do think that exemption based on earnings is going to be really critical for folks to understand, but it's confusing. And so we'll continue to kind of build out content around this, and would also look for folks in the field to understand what would be useful to kind of help folks understand what their reporting obligations are in this now much more complicated world around SNAP where we're dealing with work requirements. Want to go to the next slide. You know, what happens if we get to May 1st, right? And there are going to be a lot of folks, unfortunately, who will have used up their 3 countable months and have lost SNAP. We generally express the work requirement as 3 months in a 3-year period. But as if it wasn't confusing enough already, there are some pathways back to the program for people who may have used up their 3 countable months. So if someone uses their 3 strikes and then later on in the year, they become exempt, or they start complying, they can get back onto the program. There's also some special rules for people that do this. You know, if they become exempt or if they regain eligibility because they start working 80 hours in a month, there's like some an additional 3-month grace period that they can regain. But I think, you know, before I really melt people's brains with all of this stuff today, I think we'll table that for maybe some ongoing discussion, but did just want to flag because we get this question a lot. Even if you use your 3 countable months, that doesn't mean you're off the program for the whole 3-year period. There are some pathways to get back on, particularly if people become exempt or if they start working again, they can get back on the program. And I think with that, I'm passing it back to Beth. Thanks, Beth.
Great, thanks, Nolan. So we're going to just go quickly over a couple of things that we have shared before. I know there was a ton of information from Nolan. We got a couple of great questions that we'll want to get to in the Q&A, but just want to remind folks now that you have this information, you know, like, are heard maybe a little bit more about exemptions, what should we do? And so first and foremost, there is a screener online. Check if I meet SNAP work requirements. It is a good place to walk through. I will say, you know, some of the text may still seem a little technical. And so we would, you know, invite folks if they have questions to either talk at their READY, talk on the hotline, talk to a benefit enroller assistant. But the screener is a good place to sort of start. And then if you're not quite sure sort of how you fit in, definitely follow up because a lot of people are exempt. Here's just some more information about what it looks like. I will flag here that entering your birth date is not being saved anywhere. This is purely just to understand the age requirements, and because like when it starts or when it ends depends on if your birthday was the first of the month, the second of the month. But did want to name this because it came up in a conversation I know as we're thinking about data collection and people with fears around immigration, that this screener is not collecting any information. It's purely informational for folks. And we will work with the department to think through how we can continue to advertise that. There is a Spanish version. As I said, there's if you click yes to anything, it'll give you sort of some guides of what to do next. And if no, it will talk about sort of how you demonstrate your compliance, which is what we've walked through today. There are a number of forms and ways in which you can sort of report all of these things. The first one is through Manage My Case. We do realize not everyone has access to that or has a Manage My Case login, but that is one option where you can sort of live and see the things you've uploaded. Change report form. This is particularly helpful if you're changing someone in your household, if you realize that, you know, that your under 14-year-old wasn't in your household and you want to make sure that that's there, use the change report form. The 2341 is the actual exemption form where you can self-attest. The 2340 is only if you want to add that additional information or you're asked to do it. You are not required. That was confirmed in the policy manual, but it is there and available for folks, but it is not required. When you go in Manage My Case, Nolan mentioned there's a button. And so if you see this Manage My SNAP Work Requirements button, it means you're currently still being deemed as someone that's not exempt and needs to either prove compliance or submit an exemption. And the goal is if this button goes away in your Manage My Case, that means that your exemption has been approved. Same slide as before, a lot of different options with which to submit. The department is really trying to limit the burden and sort of have a every possible door open. I know there was a question around sort of being able to submit online outside of Manage My Case, and we will get an answer to that. But you can go to your local DHS office or your FCRC. You can submit the forms by fax, bring it in person, uploading it. You can call. And the service providers can help people with this process. In terms of confirming, as I mentioned, you know, you will not get a notice if you've been approved, but you can contact your office, you can call, you can sort of check and Manage My Case. Nolan went over this. There is still time. The best time to screen and apply for exemptions is now. If people want to avoid having a strike in February, submit anything before the month of February ends. But they can be applied at any time. And there are some rules around retroactivity that we won't get into today. Definitely easier to not have to go that path. But if a situation changes in March, in April, etc., you become pregnant, you know, life changes. Those are things that are important to file an exemption form and get that on the record until your next recertification. And then as partners, we can help minimize customers losing benefits. We already know that the number of non-exempt, non-complying people impacted by this has gone down based on all of the work that the department, you all on this call, and others have done to spread the word about this. But we know there's more we can do as we sort of lead up to May when the first folks who are impacted by this. So we'll put in the chat some of the resources that are available on the Illinois Commission to End Hunger website about changes. We'll be continuing to update these now that the policy manual is out, and we know that some of our messaging may want to shift and really try to hone in a little bit on how the reporting of the changes, because we know that those scenarios that Nolan shared are a little bit confusing, and so we're still honing what's the best message, and definitely invite people to help us with this. Need help. The last one that hasn't been listed is there are your local SNAP outreach partners. The Food Depository is one, Northern Illinois Food Bank, the Chicago Public Schools, ICER, and others across the state are sort of in communication with the state and help people enroll in SNAP, and we can share more information about those. Again, more information. We don't have a current next webinar scheduled, but we are working to get probably one on the books. We're just waiting to see schedules and sort of what's the right timing to reconnect with everyone. And with that, I will turn it to the Q&A. There are a couple of clarifying questions we wanted to get back to about the immigrant eligibility changes, and then a couple about work requirements. The first one that I wanted to lift up for everyone was around sort of the income proration. I know we mentioned if you're in a mixed immigration status household and you're one of the populations that no longer are accessing SNAP, but the rest of your household is, that your income may change. And so wanted to turn it over to Melissa with IDHS to provide a little more details.
Thanks, Beth. I think Autumn did clarify and included an example in a mixed status household. The income is prorated as well as the expenses are prorated as well. And so it depends on the number of people in the household. So I think that question should be clarified, but wanted to just make that clearer.
Great. There was also a question clarification around, and I'm trying to find it, the different statuses. And I will look at you, Nolan, around in Illinois, WAVA grantees and those who've applied for VAWA can qualify for cash and medical benefits. They're not ineligible. I don't know if you saw that question in the Q&A.
No, I'm sorry. What's the question?
If their legal status still exists and is honored by INS Department of Homeland Security. However, yes.
Okay, so the clarification was the initial question asked, like, are the legal statuses still existing? And I answered incorrectly with phrasing. I said, yes, they exist, but they're no longer eligible for public benefits. However, that's not true. Some of those folks are eligible for some public benefits, including cash assistance, and I think one other, which was related to, I think, medical. But just wanted to flag there was a clarification there because it's not all public benefits, just for SNAP.
Great. Thank you so much.
The other one was WIC because I'm a dum-dum.
And then moving to work requirements, there were a couple of questions sort of around the 80 hours and the certain amount of income. I know you touched upon this, Nolan, but if you wanted to sort of reiterate sort of top line message around the 935.
Yeah, and I apologize, folks, because it is so confusing. But because we have a higher minimum wage in the state and in the city of Chicago, I just think it's so relevant to uplift this, because there are a lot of people who are currently in the system as exempt, even though they might be saying, "Well, I'm working 80 hours a month at the minimum wage, or even at a higher wage, so I should be in the system as complying." But they're exempt first before they have to comply. And it comes down to, and I don't know why they chose this formula at the federal level, but as long as you're getting to 30 hours a week at the federal minimum wage, which is much lower, whatever that adds up to monthly is that threshold. So that's where we get that 935.25 number. I believe it's actually because in the system, IDHS uses 4.3 weeks per month. So if you do the math there, you're basically like, it's 30 times 725 times 4.3, which gets you to that 935.25 figure. And so, yes, as long as people are getting above that amount of earnings, it doesn't matter how many hours they're working, they'll be exempt. So even just to illustrate this with like an extreme example, like if somebody could find a job where they only work 1 hour and earn $1,000 per hour, like they only worked 1 hour, not 80 hours, but because they earned $1,000 in the month, they would be exempt. So again, I think there's a lot of people that this potentially applies to because we do have a higher minimum wage in the state, that there are a lot of folks who might be working fewer than 80 hours, but are nonetheless exempt because of their earnings. So hopefully that's helpful. But again, we'll continue to try to think about like what's a message that really lands with people. Maybe do we just start with earnings to say like, are you making over this? If you are, don't worry about this. I would be interested in the wisdom of the group about how to communicate this in a way that's going to land with community.
Great, thank you so much. Melissa, there are a couple of questions around Nolan's example of anxiety and mental health, and sort of providing the exemption for your limited ability to work and sort of what people need. And just was hoping you could give sort of a quick top line overview around what people have to do to report that, follow up other things.
Yeah, I mean, typically, for the anxiety example, they would not have to provide documents unless it was questionable. Documents, would be any type of statement from a medical provider. A medical provider could include like a mental health counselor.
Great. Thank you so much.
Mhm.
Noel, Melissa, anything last additional you want to double click on? I know we're at time, and we've answered a number of questions. There's a couple of more in the chat, which in the Q&A that I think we'll follow up on. But just wanted to make sure before we sign off, any last remarks?
The one thing I will note is that there was some questions in there about like which work programs count as a qualified program and which ones don't. I will just, and I don't know, Melissa, if there's anything else to share other than that this is policy that the department is working to kind of revise. And so we don't have full clarity yet as to the whole universe of programs that could potentially qualify, but certainly the ones through SNAP ENT, WIOA, those ones are qualifying. And then I think the state is investigating what other ones it could consider as qualifying. So more to come on that front. But yeah, just wanted to note that it's something that's being looked at.
Yep, absolutely right, Nolan.
Great. And then someone asked, last question, does caring for a sibling under the age of 14 not living in the same household count as a caregiver exemption for the SNAP work requirement if the 21-year-old isn't getting paid?
Give that to me again. So there's a 21-year-old caring for a sibling that's outside of their household.
That's under 14.
That's under 14, but not under 6. So the caretaking example for children outside of the household applies most cleanly to children under 6. So if they were caretaking for a younger child that's outside of the house, that would be an exemption. If the 14-year-old had other type of caretaking needs, like let's say they were disabled or something like that, that would then qualify as an exemption. But for a child, a non-disabled child over 14, it wouldn't be an exemption. One question that I might have is, could that count as unpaid work? I don't know that we have resolution on that, but I do think as far as that exemption that's listed on the form, if it's a child who's non-disabled outside of the house, that child generally has to be under 6.
I agree with that, Nolan.
Great. Thanks everyone for joining. As always, we will post the recording of this, send slides, some of the links that we've shared, particularly the volunteering one, because I know everyone's chomping at the bit to learn more about that, and appreciate the ongoing questions. If others arise, I would also recommend, if you do help people enroll in benefits, Help Hub is a wonderful place to go and sort of see a community of sort of navigators for benefits and lift up questions. And we will continue to share if there's additional webinars and events like this. So thank you.